Erectile dysfunction affects an estimated 18 million men in the U.S. alone. Dr. Elmer Pineda of Pomona Valley Hospital Medical Center gives us the definition of erectile dysfunction and the variety of treatments available.
The definition of erectile dysfunction is the inability to obtain or maintain an adequate erection for intercourse, basically a firm penis for intercourse. And that's something that really should be distinguished by other aspects of sexual function that people confuse this with. There's libido, which is sexual drive. There's orgasm, which is that pleasurable feeling right about the time of ejaculation. And there's the ejaculation where the fluid comes out. But erection is actually getting a firm penis. The symptoms vary. It can be as severe as not being able to get any type of firmness to the penis. Everything's completely soft, to being able to get a firm erection for penetration, but during intercourse, the penis gets softer. There's a variety of treatment options nowadays that are very successful. Back in the 70s and 60s, a lot of urologists or physicians in general thought that this was all psychologic. Well, now we find that psychologic is a minority, it's 10% or less. But the treatment options, we can go from the least invasive to the most invasive. And the least invasive revolve around basically anything healthy for your heart is healthy for your erections. So a heart-healthy diet, regular cardiovascular exercise can increase blood flow to the pelvic area, helping you with your erections. But there are oral medications such as Viagra, Cialis, Levitra, Staxin. There's something called the vacuum erection device, which is not a medicine or a surgery, but it's a cylinder placed over the penis that creates a vacuum for an erection. There is an injection that men can give themselves right before intercourse to get a firm penis. And there are surgical options, which are a last resort, and that is basically a penile prosthesis. Testosterone levels can have an impact on your erections. If your testosterone level is low, especially with a low libido, and you have erectile dysfunction, supplemental testosterone, when given safely, can actually enhance your erections. But that being said, not everybody with erectile dysfunction has low testosterone. Not everybody that we give testosterone supplementation to will enhance their erections. But it is something that we consider when we get blood levels that are low and a patient has low libido. As urologists, the first thing we check for are testosterone levels, or basically getting a hormonal panel. That's done early in the morning because that's when testosterone levels are the highest. And if those testosterone levels are low, that can be one reason why you can have low libido, and giving you testosterone supplementation, usually through gel formulations, can help you. But low libido can be from many different causes. It could be from stresses at work and home. It could be from thyroid disorders. It can be from other medical problems such as diabetes mellitus. And so it's not as simple as having low testosterone. You really have to look at your psychosocial makeup, psychosocial factors, and other medical problems. We're very successful in treating erectile dysfunction, especially with development of these oral medicines from the mid to late 1990s.